as Richard was getting sat down. And
It's in John, or is it just YouTube in it?
I'll send him in, yeah.
yeah, we're ready to go, Richard.
Yeah. Sorry.
Yeah, got summoned. Right, good morning, everyone. Welcome to the Overview and Management Scrutiny Committee for the 13th of November. Can I just remind you to silence your phones so we don't have any interruptions. There is not a fire alarm scheduled for this morning, so if one does go off, please treat it as live and leave the building accordingly. We'll start. So do we have any declarations of interest for the meeting? Okay, thank you. We do have a couple of apologies from Councillor McMasters and Councillor Holtby, although he's joining us online. So we'll move on to the minutes, which were last month's meeting, October the 23rd. Are we all happy with those as a correct record? Yeah. I was proposer, Councillor Walker, and a seconder, Councillor Sarabal. Thank you very much. All happy with those? Right. This morning, we've only got two topics on the agenda, but the first one in particular is obviously really key importance to the council. So although it's a relatively short report, I do want to give members as much time as possible to explore it. So we'll take it as long as it takes to do the first item, and just we'll come to the second when we're finished. So for those who are tuning in on YouTube and may not be aware, just a little bit of context. We're looking at today at a CQC assessment next steps report. Last month, the council received CQC's assessment for adult care service, and it was a very disappointing result. We knew we had issues, but it was it was a worse result than we had expected. So last month, this committee proposed setting up a new scrutiny committee to track progress on turnaround on adult care services, and this was passed at yesterday's full council meeting. Indeed, we also had a very healthy debate on the issue, courtesy of Councillor Meredith's motion, so all councillors have been able to discuss this only yesterday. But today we're focusing on the recovery plan, and this report is actually called CQC Assessment Next Steps. So this is very much where we need to focus on the way forward. We have a quite limited window. We're expected to show considerable progress on these targets by March 26, and here we are already in the middle of November. So our focus is very much on recovery. Unfortunately, portfolio holder Councillor Owen is not able to join us. Well, he's joining us on screen because he's got another appointment. So before I introduce Kim Curry, Councillor Owen, is there anything you want to say to start with?
Thanks very much, Chair. And first of all, can you hear me? Because I've got my headphones on, Andrew.
Yes, we can.
Brilliant.
Thank you very much.
So, yeah, thanks for the opportunity. I'll be very, very brief. I think we had quite a healthy debate with the motion yesterday and my portfolio holder report. We did have the CQC inspection. It was disappointing, the results, but I think it's probably best we hand straight over to Kim Curry, who can give you a proper update and answer questions. As I say, I'm having to nip off for a hospital appointment in half an hour, but I'll stay online as long as my iPad allows me. So thanks for that opportunity, Chair.
Thank you, Councillor Owen. In that case, I'll hand over straight through to Kim, who's going to talk us through the report and the way forward. Thank you, Kim.
Thank you, Chair. Everybody's seen the report, and obviously the purpose of the discussion today is to highlight some of the progress that's been made since the CQC visited in June, but also to note the ambition and the next steps for the position that we find ourselves in. So just to recap, the CQC are undertaking judgments of all councils with adult social care responsibilities to judge their progress in making sure that they execute their Care Act duties. This is a new regime of assessment that's only been in place for 18 months. So the round of judgments that is being published at the moment is the very first time that adult social care has been assessed in this way for over 15 years. So this is a new round of inspection, new round of judgments. So what the CQC are looking at is part 1 of the Care Act 2014, and it's important that we understand that legal framework. And that assessment looks at 9 quality statements across 4 themes. And those 4 themes are working with people, providing support, looking at how the local authority ensures safety within the system, and looking at our leadership. And CQC then uses a scoring system to assess the adult social care services and come up with their judgment. There are 4 judgments available: inadequate, requires improvement, good, and outstanding. There are currently 2 outstanding local authorities in the country, and at the moment, as I say, because not everybody's been published yet, 2 inadequate local authorities. CQC visited our council in the first week in June 2025, and they undertook their assessment across those themes, as I've just explained, and our overall score was inadequate, with our percentage rating being very low at 28%. This is currently, as we heard in full council yesterday, the lowest in the country at the moment. In 8 of the 9 assessment domains, we received a score of 1 out of 4. And the other domain received a score of 2 out of 4. What the inadequate judgment means is that the council is not meeting the required standard in key areas of Care Act duty delivery. And this is a judgment on the whole council, not just on adult social care. There were some areas of strength identified in the report, and I think it's important that we highlight these and also focus on them in the recovery work in the future. Our areas of strength were particularly the compassion and the passion of our staff, that when people did get into services, they were receiving a person-centred offer, and the practice was person-centred. Our carers offer was highlighted as being of good practice to the extent that it currently operates, notwithstanding that we do need to extend that. Our prisons team was identified as an area of good practice, as was our respond to the SEND inspection from 2021. The council does well on direct payments, and that was highlighted in the report, and also highlighted was our partnership board and forums and work in that arena. The report was published on the 22nd of October 2025. We actually received the draft judgment on the 2nd of September and have been working on factual accuracy on the report, but also responding to the findings of the report since that time. So immediate steps were taken by the council to mobilise resources while we were waiting for publication, so that period between the 2nd of September and the 22nd of October. And that included the allocation of a £1 million recovery fund. That decision was undertaken in September 2025 to make sure that we can bring in a strategic partner to help us to put together our improvement plan and bring really critical capacity into the service, particularly around analytics and data. Further corporate resources were agreed to support transformation, again in September, and those resources are now in place. We also sought external advice and support from the Local Government Association and from Yorkshire and Humber ADAS. And we had a Cabinet and Senior Leadership Check and Challenge session with the LGA in October 2025. A transformation plan for adult social care already existed, and that had been in train since March 2025 when I came into role. And what we've done is develop that transformation plan with detailed actions behind it to start to build a much more comprehensive recovery plan. Since June 2025, when the inspection took place, We've made progress in the following areas, which I just highlight. The full suite is in 3.3 at your report. We've identified 3 primary areas of focus, which are our social work practice, dealing with our backlogs and waiting lists, and commissioning. We had the vacancy management process lifted for qualified posts, and since then 12 posts have been released for recruitment, including a principal occupational therapist. In total, 77 posts have been released for recruitment since January 2025. We've had a new leadership development, mentoring and coaching programme put in place. And we also resolved the fee uplift situation with our independent sector providers and agreed a new model of fee uplift to go forward into the future, which is a much better partnership arrangement with the sector. We've had a new focus on the completion of staff appraisals, which in turn will inform our skills and development gaps. And we've also purchased a piece of software called Magic Notes, which will considerably reduce the administrative burden on our social workers, freeing them up to undertake assessments and reviews. We have a planned review of safeguarding in November 2025. That was originally due to take place last month, but due to ADAS capacity, it has been put back slightly. In addition, we've created a voluntary improvement board to bring challenge and support, which will be independently chaired. And our independent chair is a lady called Kath Dwyer, who is a former chief executive in the Northwest and has significant DAS and DCS experience. And our first board meeting is being held next Tuesday, the 18th. We're undertaking a review of all the corporate elements of support, such as data and information production, as that's going to be a critical element for us moving forward. And we've been undertaking co-production sessions with our residents and staff on the new vision for adult social care. They started last month and will be ongoing into the new year. Our ambition for adult social care is high. And again, in section 3.6, there's a full suite there of areas of improvement that we highlighted we wanted to make to the DHSC, but I'll just pull out a couple of relevant ones. We want to reduce our waiting lists for Care Act assessment, for DOLS assessments, for carers assessments and financial assessments by 75% by the end of March 2026. We will deliver enhanced safeguarding practice in the same time frame. We will have reviewed our approach to RAG rating and the allocation of casework to make sure that we're being consistent. And we will also have launched and reviewed our new model of practice and our new quality assurance framework to make sure that our social work practice is among some of the best in the country. We will have evaluated our carers support service and responded to the challenge to develop a wider reach of that service. And we will have held 5 improvement board meetings. In addition, a strategic commissioning strategy to address sufficiency issues will be in place. And we'll have developed a new framework of expectations with our staff to make sure that our productivity and effectiveness in case management is as good as it possibly can be. We'll also have refreshed and embedded our supervision and new PDR processes, and we will have made sure that all our care providers are visited at least annually through an eyes-on visit. So although there's nothing to make a decision on in the report, we're asking the committee to note the report and happy to take any questions that there are. Thank you, Chair.
Yeah, thank you, Kim. As you say, this is the next step report is really its experience. This is really a roadmap of how we get from here to next March. And if I can take Chair's prerogative and ask the first question. So we've only got really one quantifiable target in here, which is a very ambitious reduction on the waiting list. The scrutiny committee that's been set up is going to need to see KPIs and mileposts and see evidence of delivery on these areas you talked about. So when do you think they'll be able to see sort of detailed KPIs and progress that they can actually evidence?
You're absolutely right, Chair. And the reason that they aren't included at the moment is because the recovery plan is subject to scrutiny from a number of different places. So we've just had, as you'll know, the Section 50 notice that was issued by the DHSC did not go down the route of statutory intervention. Although from what we have been told, Paul and I in particular, there was a very, very heated debate about whether the minister should take that action or not. Because of the actions that we'd already taken and the information and the discussions that Paul and I and the leader and deputy leader and Councillor Owen had with the DHSC, we have been given that 6-month window to improve without statutory intervention. What that means is that we have an independent advisor allocated to us. That has just happened in the last week. And the independent advisor, it's a lady called Dr. Carol Tozer, who has experience as a DAS and as a DCS and in the NHS. She needs to have a very clear sight of this action plan and have input into it. So she is coming on site Monday, Tuesday and Wednesday next week. We'll be going through where we've got to with the recovery plan so far with her and taking her advice and her support and guidance on what that needs to look like. So we're developing the KPIs over the next couple of months. We're also bringing in, as I explained in the report, a strategic partner to help us with that, and particularly to bring in a national best practice to help us craft those KPIs and really understand what it is that CLT, that the new scrutiny committee, that this scrutiny committee, and the Health and Wellbeing Board and Cabinet need to see to be assured that we're moving in the right direction. So it is in hand, and we would hope to have the plan completed early in the new year with the KPIs, but that is dependent on a number of other people's input at the moment.
Thanks, Kim. Yeah, we appreciate that. It's good that we're getting some support from the DHS. I suppose it's a bit of a vote of confidence in you and your team that we're getting that support as opposed to a commissioner imposed on us. So even though we had a very disappointing result, we are being given the opportunity to set our own course here and turn around. So look forward to seeing those KPIs. Next, Councillor Sarable.
Thank you so much, Chair. And I would like to first say, you know, since our last meeting, congratulations to yourself as appointing as the chair, and congratulations to Paul Benotti to be our chief executive for the US. So I have a few questions, Chair, if you may, but I'll start with the first one. Kim, first of all, thank you for presenting the report. My question is, the first question is, when did you, what is the timeline when you start having these amber or red lights about these reports coming? Because this is not an overnight or, you know, this is a buildup of issues, right? That now you are saying by section 3.6, you're going to put an action to plan. But moving back to 18 months or 24 months, when was actually the red flags or amber flags in your directory happening? And, you know, how did you flag it? Who has to know? Or, you know, let's put it this way, you know, we end up with a report on 22nd of October, but there is a backlog of, you know, evidences or things are not working. Can you talk to us a little bit about that? Because I want to expand on a problem of how these things build up and how we are going to achieve all of these if the system is still the same.
It's difficult for me to comment on some of that because I've actually only been here since February. So I can only comment on what I've done since February. So what I will say is that and I think Councillor Owen expressed this in full council yesterday, there is nothing in the report that we were not aware of, certainly that I was not aware of. And as I explained when I was going through the report, there was already a transformation plan that I'd put in place to deal with a number of these issues. What I think what the gap is, and there are lots of national debates going on about this at the moment, is in what the CQC found and then their judgment upon those findings, which in some cases are inconsistent nationally, but that is being dealt with by the Association of Directors of Adult Social Services in discussion with the CQC. So you'll have read in the report that there are issues around leadership, that there are issues around information and performance, particularly performance information, sorry, and around data that have been ongoing for some time. I'd already put measures in place to deal with some of that and to put in place a new performance framework so we actually understand where we are. So, for example, on deprivation of liberty safeguards, and again, this came up in full council yesterday, if somebody has a best interest assessment to deprive them of their liberty, that has to be signed by a suitably trained individual. When I came into post, that figure was standing at over 400. As of the end of last week, it was 14. So we've already put actions in place to deal with some of those backlogs, and that's just one example. So all I can say is in the not quite 10 months since I've been in post, we've been taking action to tackle these issues, as I say, none of which were a surprise to me. And the recovery plan builds on that in more depth. So I think what we will end up with is something that we all recognise is a very comprehensive and fulsome response to the CQC findings.
Thank you, Kim, for the explanation.
Okay, any further?
Yes, just one further one. So you appointed on February, July, there are some actions that has been taken place, or actually June on section 3.3. And now the report was in October. So the specific point is, so before February, so you just appointed after that, before that, how that was affecting the workload that you have now, and comparing that to this delivery plan, are you going to still have these issues that the committee or we need to be aware of it? What challenges are? Yes, easy to say, okay, I'm going to achieve this by 3.6 by 2026 March, which is in fact, if it's going to be 1 year since you are appointed as a director. So Kim, my question is, what do we need to be aware? What are the battles? What are the challenges that, again, it might happen? So we want to learn a lesson and not let it to repeat until March. So more specifically, I want to expand on the challenges you are going to face, and you think that it still is not going to be, any changes or improvements under those challenges.
The one thing that it's very difficult for us to influence is demand. So you'll know nationally, certainly from media reports and certainly local reports as well, that we cannot turn the tap off for the demand for adult social care. So particularly in the East Riding, because we have a much higher population of older people who call on our services, we need to make sure that the productivity of the resources that we have and our response to the requests for services are as efficient and as effective as they possibly can be. Until we're assured that our productivity is as good as it can be and that our responses and our practices is as good as it can be, it's very difficult to determine what the gap is. So what I've been working on since March is to understand what our productivity should be, that all teams are working in the same way, that they're working consistently, that we have a consistent and applied set of policies and procedures, for example, and that everybody is using our data capture system. So once we have made sure that all of that is embedded and it's all been done consistently, then we'll know what our gap is and we can take steps to address the gap. And I have the support of Cabinet and of Paul and CLT for any additional resources that are required. But it's really important for me and for the Directorate to know that they're working as well as they possibly can. And I think that's something that we probably need to go back to some basics on and just check and challenge ourselves that we're doing what we can with the resources that we have in the best possible way. So we really genuinely understand if there is a gap between what we're being asked to provide and what we are able to provide.
Councillor Redshaw, please.
Thank you, Chair. Couple of questions, please. The CQC was full of praise, clearly, for the staff, particularly in customer-facing roles. How are we proposing to engage with frontline staff and listen to their, shall we say, lived experience to ensure their voices are heard as we map out the future of service delivery across the East Riding?
Yeah, that's a really important question. Thank you, Councillor Redshaw. During the CQC assessment process and in the lead up to the process, we introduced a new raft of communications with our staff and all sorts of different platforms. But really importantly for me, and I say post-COVID, but we're well post-COVID now, was that they had the opportunity for face-to-face meetings. So visibility of leadership has been something that since I came into post, I've been pushing strongly. So that staff have the chance to meet with leaders, to meet with their managers, that they're able to discuss their concerns, and we're able to take their view about what's happening and what we should be including in our recovery plans. Our frontline staff have really clear views about how things should work, about what works for people out there, and quite frankly, about what drives them mad and we need to change. And during the CQC process, it was really important that we engaged with them, brought them into venues that were suitable for them to access in their local areas, and talked to them about the process, but also about some of the, as it was at that point, transformation work we needed to do. Since we had the CQC report, we have had all staff workshops. So we've held some in Bridlington, some in Beverley. We've had mop-up sessions online. We've just started drop-in sessions with myself and Laurie Austin, who's our principal social worker, so that staff can come and talk to us about whatever it is that is on their mind at the moment. So some of those sessions are quite free-flowing and others have a theme. So for example, earlier on this week, we had a theme session on equalities, diversity and inclusion, and staff came to talk to us about that. We have weekly and sometimes bi-weekly newsletters, and we're also looking at the moment through the staff survey about how we can start to improve our communication with those staff that we don't very often get to see. So for example, some of our staff who are out in rural areas, who are out in people's homes on a daily basis, but also who perhaps work nights in our residential homes. So we're looking at some social media responses to that as well. So I'm absolutely committed to maintaining and increasing the level of communication that we put in place during the assessment process with our staff for the future.
If I may, the second question, the main problem clearly identified by the CQC related to the front door, the access to services. Assuming that we do resolve that situation, how is that going to impact the level of burden on existing services and staffing? And we need to recognise that up front, that this is going to cost a lot of money, both in terms of systems and staff. And I suppose the question in that sense is for the portfolio holder. He mentioned yesterday that resources required are going to be substantial, and it's a case of what is this going to cost, and is there an overall threat to council finances moving forward in terms of maintaining a balanced budget?
So I'll come in there if I may. There is
Councillor Owens there, not the meeting. Okay. So if you could respond, Campbell.
It's gone. Where was I going to start? Yes, to go back to the productivity issue that I just raised, that's really important in the front door. What's also important, and what we're piloting at the moment, is using our front door staff who are incredibly experienced, and those front door staff in our information and advice hub that's just over there in Beverley also include social workers and occupational therapists for when more complex requests come through. They are undertaking a much more detailed triage. And we're trialling that at the moment because there's a process that's been used nationally, and certainly that I've implemented in 2 local authorities in the past 10 years, called the 3 conversations model, which is very much a strengths-based focus model of social work practice, that at the front door, rather than just filling in a referral form, has a longer conversation, and is the result of that conversation is the production of a care plan, a light touch assessment in effect, that aims to delay and defer people's entry into statutory services or commission services. And what we do during that triage process is to direct people to community-based resources, to voluntary and community sector organisations that may be able to help. So, for example, in tackling social isolation, rather than leaving them on a waiting list for a full Care Act assessment, which just quite honestly, in many cases, isn't appropriate. We've got a pilot running in Bridlington at the moment with Hey Smile to direct people from our current waiting list to voluntary and community sector organisations and community organisations. And then we're following that up to understand if that's met their need or if they still require a full assessment. So there's a number of pieces of work going on to make that discussion at the front door much more comprehensive than it currently is. However, you're absolutely right in that tackling the waiting lists that we have and in providing resources for more people, that will have an impact upon the budget. We can't quantify that at the moment. Another piece of work that we're undertaking with our strategic partner and some work that's been going on in the council through the transformation team has been around demand and capacity mapping. We need to understand much better how to forecast as far as we can our demand, and there are national tools to do that. So I think once we get better at forecasting our demand, once we get better at managing our productivity and capacity, we will then, back to my previous point, understand what the gap is and be able to quantify that gap financially and hopefully to profile it better into the future, because we do know what the population statistics are saying for the East Riding. So although I can't answer that question at the moment, there will be an impact, and that's how we plan to understand what the impact will be.
Thank you. I think the Chief Executive wants to
Yes,
comment.
only to add that with Kim Curry's help and Merlin Joseph's help, we're having a very strong focus on our early intervention prevention work. So because if we can slow down that demand by bringing more fulfilling lives for people before they enter the care system and need those care assessments, then it will help us with our budget challenges going forward, Councillor Redshaw. But we need to act collectively across the council, across all the directorates, to put social care front and centre of our work, to make sure that we are giving people the opportunities to lead fulfilling lives before they enter the care sector. And that early prevention intervention work, we think, can help turn off the demand tap and ensure that people are able to enjoy their lives independently for longer. So I think that's the key really for managing budgets going forward, is to ensure that we're doing absolutely everything possible early to avoid that demand coming through.
Thank you. Councillor Richard?
I just have a wiggle on that one.
Mhm.
Clearly, as far as the budgets and finances are concerned, there's been two areas that have been of concern, in particular to the council: adult social care and children's services. Now, I know there's a report due out shortly on SEND facilities, SEND services. When can we expect that? Because that's clearly an area that's going to have an impact on the budget and affect how we might also deal with the adult social care.
Yes, that report's still embargoed, I believe, and but it should be published very soon. I don't have a date to provide for the committee today, but if we ever do it, when we do get a date, that will be shared.
Okay, thank you.
Thank you. Councillor Walker is next.
Thank you, Chair, and thank you, Kim, for this considerable list that we're looking through. Towards the end of point 3.4, the bullet points are talking about co-production session with residents, probably well underway at the moment. But I'm wondering, into which forums will the public voice feed, and where will they contribute, and how will that be analysed and reported later, so that we're certain we're capturing the user's voice in this, and that reaches all parts, including the voluntary improvement panel as well, please. So into which forums do they feed, please?
So we have a co-production officer in adult social care, and he directs that information for us, and he gets our users involved, our users and carers involved, and also our potential users and carers and our ordinary residents who may not ever come into services, involved in discussions around various strategy developments. I'll use the unpaid carers strategy as a recent example. We had a lot of input from people with lived experience and also from our minority communities into that strategy. Those strategies, of course, are then reported through the Health OSC, through the Health and Wellbeing Board, and into cabinet. So that's where those voices land ultimately, and ultimately in council, where we have those strategies presented as well. So that's the flow through. We did some work with the Social Care Institute for Excellence before my time, 18 months, 2 years ago now, and our co-production methodology is based on that work and is held up as good practice nationally. So having that role is something that really helps us to do co-production well. Notwithstanding that, we do need to reach out better to our minority communities, as you'll have seen through the report, and more widely. I think that's a council issue, and how we make sure that our equality, diversity, and inclusion is really embedded in everything that we do.
Any follow-up, Councillor Walker?
Yes, please, Chair. Yeah, but you've answered the EDI issue just at that moment. But I'm still interested in the depth of co-production, which in some areas might mean that residents are helping to drive the agenda of the engagement sessions. In some cases, they chair the engagement sessions, but I'm not clear how we will be certain that we're gathering the conversations and the topics that they wish to air. If we're co-producing by listening and embedding their answers, or if we're involving them in developing that conversation. So the depth of it, please.
So I think at the moment that's variable. I think we've got work to do with our communities, with our residents and with our groups to really support them to have the confidence to lead those conversations and direct those conversations. And we're at the relative beginning of that process, but certainly our experience with the unpaid carers strategy was very much being directed, particularly by the LGBT group in that strategy. So that's a really good precedent and example for the future for us to use.
Thank you. Councillor Healy, please.
Thank you. Well, first of all, Kim, I just want to offer you our full support because this is a difficult time for you to come in on the back of this. I've got every confidence. I know that I was on your selection panel and I know that you were aware of the issues then that we talked about. I've got every confidence that you're the right person to sort this out. I've got a few questions I just want to sort of ask you. This phrase, and these are technical questions, and you can probably just explain. I keep hearing this phrase, this is a judgment on the whole council. I don't quite get that. I thought this was a judgment on adult social care. So just explain what that means. That was the first question. The second one, is it okay just to run these together, these questions, because they all kind of interlink? The second one was to understand a little bit more about the strategic partner. Because again, I'm asking these questions because I need the answers, not because I'm trying to make any political points or anything like that. You mentioned Dr. Tover, I think. Is it Dr. Tover? Tozer, I beg your pardon. Is this person going to be the recipient of the £1 million? If not, how is that £1 million being spent effectively? I'd like to know a little bit more about the Voluntary Improvement Board, because obviously that's something that you've set up since the 2nd of September. And I know we were having some conversations yesterday with Councillor Meredith in his motion about what's actually being proposed. So obviously, I know that this is a separate board from the new Scrutiny Committee that's been agreed. So just tell a little bit about that. Following on from what Councillor Walker just said, the voices of the staff as well, because one of the things that seems really important for me is that the people at the sharp end know what's going on and how are we engaging with them. And as far as the scrutiny committee is concerned, I don't think it's for this overview management committee to try and get into the depth of all the issues that's been raised by the CQC report. What we're looking at today is your plan, what you've done so far. I won't be a member of this scrutiny committee, but I'm hoping that one of the things that gets really tackled is this question of lack of member-led oversight. Now, this was one of the things that was brought up, I mentioned yesterday at full council, in the peer review, and the lessons from then around leadership, governance, strategic direction, and lack of members-led oversight. So it is my hope that the scrutiny committee will decide what it wants to scrutinise rather than being told by officers what it needs to scrutinise, because I think one of the big issues around the culture is around scrutiny and around the way scrutiny is done here in terms of member-led involvement. So I would hope that that scrutiny committee will be able to get into each of the bullet points, like, you know, why are people facing unacceptable delays? What are you doing to listen to seldom heard groups? What are you doing to improve timescales for recruitment? And you've already touched on that. What are you doing about safeguarding? But I don't want to go into those things today. What I'm saying is, can we be assured that the new scrutiny committee will be able to tackle line by line the issues that were raised in the report, and be able to set their own agendas, if you like, for the way that those issues are scrutinised, so that when they come back to this committee, we've got an overview. Sorry to have laboured the point, Chair. Sorry, there's a few things there, Kim, but yeah, thank you.
There's a lot to unpack there. Sorry, there's several questions. As far as the scrutiny committee, I think you're quite right, Councillor Lee, but that's not really for Kim to answer. We will, I'm sure we'll both be members of that committee and ensure that we do. The whole point of setting up the dedicated scrutiny committee is that we can get into the depth and a lot more detail. And it's also, presumably it's going to be a fairly short window for this scrutiny committee to operate. So we'll be having regular meetings for updates and delving into the detail. So, but there were a number of other questions from Councillor Healy. Kim, if you could address those.
Okay, so firstly, on the judgment on the whole council, it's the responsibility and duty of the council to execute its duties in response to the Care Act. It does that through the DAS as a statutory officer, and generally speaking, through the establishment of an adult social care directorate. That's not the only way it can be done. There's an example in North East Lincolnshire that's quite different, where services are provided in an integrated way through the NHS body. So you effectively delegate your responsibility. So that's why it's a judgment on the whole council. It's the council's duty. And CQC are very clear that this is an assessment of the council's execution, and DHSC are similarly clear. How the council chooses to do that, the method by which they execute, is what is then assessed. So I hope that's clear. There's a number of players on the pitch at the moment, and I think your question is really helpful in terms of clarifying some of that. So firstly, Dr. Carol Tozer is our independent advisor who has been appointed by the DHSC instead of statutory direction, but she is in effect DHSC on site. She has a direct line to the Minister. She'll report to the Minister on a monthly basis, and it's her opinion that will be given to the Minister after 6 months about whether she is confident that we are in a position to complete our recovery, or whether he needs to intervene in a statutory manner. Our strategic partner, which is what our part of what the £1 million of allocation was given to adult social care for, is that additional capacity and capability externally coming into the department to help us, particularly with that analysis, with demand and capacity, as I explained, with bringing in national best practice, helping us with our improvement plan, our KPIs, and setting the programme and project plans for us to achieve our recovery in an effective way. We don't have that capacity and capability in the council, and we don't have it in the directorate. So that's again, it's a very usual response to an inadequate judgment. And if I draw on children's experience, it's generally anticipated by Department for Education, for example, that if an Ofsted judgment of inadequate is prevailing in a council, that they bring in outside capacity and capability to assist. Because of course, if we don't do that, if we're not subject to challenge and we just have exactly the same structures in place, how are we going to achieve what we need to achieve? If we keep on doing the same thing we've always done, we'll get the same thing we've always had. The voluntary improve.
Please, Dennis. Yeah.
So just to be clear then, Dr. Tozer is affected. I mean, because there was this discussion about, you might have to have statutory intervention. What you're saying is Dr. Tozer is not statutory intervention, but she is because she's got a direct line to the minister. So in a sense, she is statutory intervention. Is that correct? And the second question then, just related to that, is I'm still not clear about the strategic partner. Who is it that you're bringing in? I know you're bringing Dr. Tozer in, but who else is going to be coming in, presumably from the £1 million? Is that what you're saying?
No, just to clarify, DHSC fund Dr. Tozer to come in. We don't pay for that. That's their appointment, and they send her in instead of, and you'll probably be familiar with the language, what would happen in children's services or in councils that, for example, are in financial difficulty. They would put in a board of commissioners. That's statutory intervention. That's the next step. The minister decided, as I say, after much debate, not to go down that route for adult social care, but he retains the right to do that if after 6 months, according to Dr. Tozer's recommendation, we're not in a position to do that ourselves. Is that helpful? Okay. So the
strategic partners, because presumably that money is being spent on the strategic partners, if not on Dr. Tozer.
The strategic partner, of that £1 million, some of that is being allocated to a strategic partner, and we're just in a procurement process for that at the moment. So some of that £1 million will be used for the strategic partner. The rest of that money will be used for additional capacity for the service to tackle our 3 main priorities.
Is that going to Cabinet then for the decision on the strategic partner? Is that in the melting pot to go to Cabinet? I know Cabinet papers have been issued, but I've not looked at them yet for next week.
Chair, it's delegated authority to myself and Kim Curry to make that appointment, but it's going through procurement at the moment.
Thank you. Sorry, Councillor Lee?
I'm just saying, should member-led oversight not be brought to that discussion?
Chief Exec.
Chair, respectfully, the point is that the assessment of a strategic partner needs to be undertaken by qualified people experienced in social care. So we know what we're buying, that there's experience, knowledge, qualifications behind making a judgment in which procurement partner, which strategic partner should be appointed to assist us going forward. Look, there's a lot of experience out there. We're not the only council to have an inadequate rating. There are heaps of improvement partners, consultants out there that assist councils in this field. There's a very strong field for us to choose between, and we hope to come to a decision very shortly. And of course, when that contract is let, we will manage it really carefully to ensure we get value for money for our investment. £1 million is a great sum of money. It's a huge sum of money. However, the annual turnover and budgets in adult social care are topping £170 million per year. So it's a fraction, a very small fraction of our overall spend to support people in social care, in adult social care. Look, we didn't want to be in this position, but we are, and we're very, we know, and we're up for this improvement journey. We're excited about improving the outcomes for our residents, and we're going to put every effort behind that improvement journey over the next 6 to 12 months, and hopefully speedily come out of this inadequate rating as fast as we can. And this strategic partner will be one of the factors that will help us to come out of that judgment more quickly.
Thank you, Paul. I mean, it's £1 million that the Cabinet approved last month, but we already know that there could well be further investment needed in terms of systems and appointments and so on. So, and the signal's been given that in whatever is needed will be available to deliver this turnaround. Isn't that true?
I don't have a prediction yet or a projected sum in mind for that may be required to support adult social care in its journey out of inadequate to good, or hopefully better. But we'll bring that back should we need to. Look, it's not because of a lack of funding that we're in a situation where we are today with an inadequate rating. We have funded adult social care and met all of the needed expenditure in previous years. All of the overspends have been matched and funded into future years. It's not a factor of too little money from the council's investment. What we need to do is to ensure, as Kim has described, that we are effectively spending that money to achieve the best outcomes possible. Look, you know, we've got a great team here at the East Riding. We're going to bounce back here and get towards good and outstanding performance as quickly as possible. And there's an immense energy from our staff and directors and ourselves to make that improvement journey as speedily as possible.
If I can just come back to the voluntary improvement board, that's the third leg of the stool, really. So the voluntary improvement board was something that we set up, and we did that in the knowledge that, again, taking learning from children's services, where children's services have had an inadequate rating, quite often they are required by a commissioner to set up an improvement board. So we did that voluntarily, hence the name, and also saw an independent chair for that board to bring that external scrutiny. And I think the setting up of that voluntary improvement board was one of the factors that convinced the minister that we didn't need statutory intervention. So as I say, the first meeting of that board is next Tuesday afternoon.
Are they officers in? Can you tell us who's on that board?
It's a broad church on the board, so partners and officers. So myself and Paul, the Section 151 officer, people officer, and the transformation director. And then we have a number of our stakeholders. So as I explained, we have hopefully Gaynor Saunders from the Hull and East Riding Care Association. We have David Howarth as the chair of our Carers Action Group. We have Simon Cox from the ICB. There's just a couple of examples there. So it's a broad church, and that's exactly how it should be. And we've put that membership together under the advice of the independent chair, and who she wanted to see on the board and wanted to hear from.
Who is the independent chair, and are there any members on that? Does it have any member-led oversight? Any member oversight?
It does. Councillor Owen is on that board, and the chair is, as I explained, a lady called Kath O'Dwyer, who's a former chief executive from the North West, and she also has DAS and DCS experience.
Okay, I think you've had 3 bites at the cherry there, Councillor Healy. So yeah, indeed. Councillor Smith.
Thank you, Chair. Most of my things have been answered, you'll be pleased to hear, so we don't need to go over old ground. I don't envy the position you're in, but I'm pragmatic enough to realise that you've come in at a later stage, so we've all got to get on board together and solve this problem. But there are a couple of things I'm just still not clear on, and I know you've tried to explain them, so I'm going to ask them in the simplest term possible. I want to know what this strategic partner is, and Paul, you said you'll know what you're buying. I still can't understand, what is it you're actually buying? Are you buying a consultant? Are you buying expertise from a specialist company? I just want to know what the product is in simple man's terms, if that's okay, because normally when I hear the word consultants, and it's expensive.
Yes, you know, that's you know, you're right to challenge, you know, about the expenditure that the council makes to support this improvement journey. Look, we're happy to share the specification for the strategic partner. It is a consultant, external consultant. It's vital that we do get external peer challenge from consultancies that are aware of good practice across the country, can bring that challenge and support to us to improve our services going forward. We know that data, going back to Councillor Sarabell's first point, data information being well cited on our performance is essential for good performance going forward. Because if we can get, if we're aware of where there are deficiencies and areas of that needed development, we can tackle them. And those sorts of measures are alongside improve understanding our demand, future demand going forward, the available capacity we have to meet that demand, what steps we might need to take to meet that demand pressure going forward, how best to utilise the resources that we have currently for best effect. Those are the sorts of things that we should get pragmatic support from that external strategic partner. Or, as I said, there are a lot of players in that field, a lot of consultants and there's a good range of choice for us to make a decision.
I want to ask you, so when I don't want you to tell me the businesses that are applying for this contract, 'cause I know you can't, but if I go and I want to go and research, what type of consultancy are you buying? What would that niche be? So I can go and research what type of work those consultants undertake, please.
Well, hopefully I can save some time. We should be able to make an appointment very soon. And as I said, I'm happy to share the specification for the contract, the scope, so you can be cited on the areas of work that we would be expecting the strategic partner to assist us with. So hopefully I can save you some time. And when you get that information, you'll be able to do your own research on how those consultants have helped other councils in other areas with inadequate ratings to improve their performance.
Thank you.
Okay, and I've got a couple more if that's okay.
Be
The
quick.
other thing that's come up is, so based on the report and what I'm hearing today, so it's not a funding issue that we're having this problem. It's not down to the people on the front line we're having this problem, according to the report, and it's not down to the leadership. So why are we in this predicament if it's not those three factors? Is it purely the methods that are being used by the council to deliver services in the community? Is that why we're having this debate today?
I don't think we've said it isn't the leadership. I think the report is very clear that having 5 DASs in 5 years has brought a very unstable position to the leadership of the directorate. So hopefully I'm here. I'm not intending to go anywhere at the moment. And you know, I was born and brought up here. This is where I'm from, and I feel incredibly privileged to be doing this job in my hometown. So I think my observations of coming into this role new are that, and it's perverse really, but because the council has been very well managed and very well run, and because they have been a good council and haven't had until very recently significant financial problems, there hasn't been the same level of transformation and change in adult social care that has happened in other areas, because there hasn't been the same imperative. So by being a good council and by managing our finances well, actually what that means is we haven't forced through some of the changes that have happened in other areas to modernise adult social care. As I explained at the very beginning, when I started the report, this is a new regime of inspection. So it's still, the country is still learning. The 153 adult social care services across the country are still learning from this process. And in many cases, you know, reeling from the assessments that have been done. So I think the report is clear about where the responsibility lies. I think we're clear about what needs to change. But we have some way to go to catch up with other areas who perhaps reached those challenges before we did. That's my assessment for what it's worth.
It's a quickie because we've got other people waiting and we're running out of time.
And then finally, and I know Councillor Edshaw touched on it, and I need to ask this question, is how are we going to pay for it? Because when we look at the report and the findings, that they said that we came in at 16.5%, you know, the best part of over budget on health last time round when they ran this report. So that's quite a high number. And then by my quick calculations, based on the numbers of people that we have and the figures going in, it's breaking down to about £21,300 per person who comes in contact with us, who has health, well, who accesses these services. If we average that budget out across the number of people that are accessing it, so if I'm hearing this right, by triaging people, what you're hoping to do is tackle this by also trying to reduce the number of people that are coming through the door. So to get that figure at the moment, that's what 7,760 in this report. If you can get that number down, and that's going to help us with the budget. Is that what you're saying to me?
In our financial plan, we are showing an increase in net budget for adult social care, upwards of around £40 million over the next 4 years. Much of that, significant part of that, is to meet ongoing increases in demographic demand. So it's already in our financial plan, the increasing demand for care services going forward. If, however, there is more demand than we've predicted, then we'll need to make some tough choices about how we fund that demand going forward, because we still need to meet the requirements of our Care Act. But we will tackle that head on, find the funding to meet our responsibilities under the Care Act, and make those tough choices, because we always have done in the past. We've always found the funding needed to support adult social care, and we'll do so going forward as well. But at the moment, I can assure you that there is additional funding year on year in our financial plan to meet that demand going forward.
Thank you, Paul. I want to bring in Councillor Phoenix next, but before we do, Councillor Holtby, who's watching us on screen, I can see you've got your hand up. Unfortunately, you're technically not in the meeting, I'm afraid, so you won't be able to ask a question. Sorry about that, but that's them's the rules. So, Councillor Phoenix.
Thank you, Chair. Thank you, Kim, for your comprehensive explanation. I just want to go back to the bit that we talked about earlier regarding people who were waiting for the service. And I'm really interested in the comms side of things and how we can make sure going forward that we communicate to those people really well. I've had a couple of people who were waiting for things but didn't get an explanation as to why they were waiting or how long they might wait. And I think the report talked about that, didn't it, about the waiting times. And I think that I'm one of those people that if I've got information and people tell me what's going on, I can tolerate waiting, but if I don't know what's going on, I get really frustrated and anxious. So that's my first question. How, going forward, how we're going to make sure that for those people that are waiting, we keep them up to date. The second question, I think, has slightly been touched on by Councillor Healy about the Voluntary Improvement Board. I just wondered about Health OSC and its relationship with Health OSC, or does it not have any relationship? The new Health OSC, whatever we're going to call it, yeah, I don't know. Secret, yeah. So that new board. And the third question really is about yourself, Kim, because we know that we've had so many leaders in this organisation, and my concern is we want to make sure that you are looked after as well, because what we don't want to happen is, for whatever reason, those people left, and we really kind of never get to the bottom of that. We want to make sure that you're not going to go through that same process and be upset by whatever it was or want to leave. And I want to know not what you're doing about that, but what, for example, Paul might be able to explain, that we are making sure that you feel like you're really looked after. And I'm sure he will say that, but I'm just thinking ahead to how we can prevent this from happening again. Thank you.
Okay, thank you. Thanks, Councillor Phoenix. So one of the things that, again, the report refers to in terms of reducing our waiting lists is also about reviewing our approach to waiting well. That's needs kicking off. We've already started doing the work to bring the waiting list down, but actually what we need to do is make sure that while people are waiting, that their condition is not deteriorating. So the prevention work that Paul mentioned from a council-wide perspective, but also that early triage is going to be really important. When I explained about the early triage and people having a light touch care plan, part of what will happen is that people will be given a named contact and they will be kept in touch with much more frequently. So if their situation is to change very drastically, we've actually got a whole wealth of information on which we can act rather than having to start again with another member of staff. And then we can put measures in place to deal with problems at the lowest possible level as they arise. What we're also hoping is that by, and again, the pilot is being run in Bridlington, by doing that work much more closely with the community and voluntary sector to focus on waiting well, some of the issues that are quite low level when people come into the service can be dealt with much earlier to prevent them escalating. So it's kind of a layered approach to making sure that people don't get to the point at which they are considered to be red, but actually it's a real shame that their condition has changed so much when a relatively simple and inexpensive intervention, such as attendance at a VCSE group in the Bridlington area, could have delayed or actually stopped somebody getting into that position. We're also reviewing all our communication, and that's part of that new triage process. We're looking at a number of different ways, and we're taking some soundings from best practice nationally on how we keep in touch with our residents. So, for example, at St Helens Council use an automated, where people have the facility and ability to do it and have signed up for it, an automated text service to say, let us know how you're doing. Do you want us to call you? How are things going? Has anything changed? And you can book a call in in response to that text. So we're looking at all the AI and automated solutions as well as the in-person solutions, because we know that not everybody will have access, for example, to good Wi-Fi, particularly in those rural areas, or may not want to use that methodology. One of the other things that we're looking at as the wider council prevention approach is using our leisure centres and our libraries in a much wider scope than we do at the moment. So providing additional training and support to our staff members who work in those environments to deal with any inquiries around social care at a low level, again, from that triage perspective and knowing where to signpost people with those lower level needs. That's a much bigger piece of work, as I know you'll appreciate, because we talk about prevention a lot at Health OSC, but it's something that Paul is absolutely keen to kick off and I know is really committed to, as are Merlin, myself and Andy Kingdom as well. It's absolutely crucial to this agenda and was flagged up in the CQC report. On the issue of the Voluntary Improvement Board and the link to the new Scrutiny Committee, I think we still need to work some of that through, and we need to work that through with the chair of the Voluntary Improvement Board, the chair of the new committee, the chair of our current Health OSC, and probably the Health and Wellbeing Board as well. We need to understand, and I'm looking to Rob here, but how all of those things will circle around in the governance structure to make sure that firstly we're not repeating anything or duplicating, but secondly that the right reports are going to the right places and that the right level of scrutiny is taking place. So I will defer to my much more experienced Democratic Services colleagues on that one. And just to give you some assurance, and I know Paul will come in, but since I've started in this role, I have had nothing but support from Paul in his previous role as a colleague on CLT, but now as Chief Executive, from Alan and from Cabinet. And I think what I would say is that there's been a realisation that we cannot carry on churning through leaders in this critical service indefinitely. It was recognised as a problem, back to Councillor Healy's point, at my when I interviewed for this role, and we did discuss it in that meeting. But if it changes, I'll let you know.
I'll
Thanks.
just quickly bring
Yes,
to
Paul.
the Scrutiny Committee's attention that at Cabinet next week, there are two reports. One report is to seek agreement to set up an appointments panel to recruit to a Director of Commissioning and Integration in Adult Social Care to support Kim in her role. And the second report is to bring in an interim recovery director to support this additional work that's required. So you can only imagine, you know, it's a massive role being the Director for Adult Social Care in that statutory space. But in addition to that, we're asking Kim ultimately to lead us through that massive recovery programme. And to reflect that, we are planning, with agreement from the Cabinet, to bring in an additional interim director to help with that recovery for a period of up to 12 months.
Thank you, Paul. It's good to hear that those appointments are being made. We haven't mentioned commissioning really this morning, but that's clearly one of the longer term issues that we need to resolve, because that's been the big challenge to managing our budgets in this department. So very good to hear. Anything you want to follow up on, Councillor Phoenix? Okay, thank you. Councillor Meredith.
Thank you, Chair, and two questions, if I may.
If you're quick. I mean, we are spending more time on this than we planned, but I think it's
Yes.
worth it. So please do. Yeah.
Well, the first thing I'll do is start with a point before leading into a question, and that is that it's been mentioned the council is being assessed as an authority as a whole. I think that, to be fair, is somewhat pedantic and, dare I say, even a bit overly inflated of those in an industry looking at this authority and suggesting that their industry is simply the be-all and end-all of every other element. There are 650 services at this council. In the last month alone, Live Labs has won the Net Zero Project of the Year. The Local Authority Recycling Advisory Committee has shortlisted us for our Blue Bin campaign. The Visit East Yorkshire team has been shortlisted for the Best Local Authority Events Team of the Year 4 years in a row. So to say that this council is failing is factually incorrect. And I wanted to make that point very, very clearly. This is not a good situation we're in, but to suggest that the council as a whole is not being run correctly.
Point made, but
is
can
wrong.
Can we get to a question?
Which brings me to the question, Chair, because I wanted to echo Councillor Healy's sentiments that we're here to offer support, but support can only be done in a pragmatic sense. So my question is about care homes specifically. Now, I don't want to go into the minutiae. As Councillor Healy said, we're here to look at the roadmap, not the destination. That's for the other scrutiny committee to follow that journey. But if we don't have the facilities in place, if as an overview and management committee we do scrutinise the capacity of the council, we've talked about staff, we've talked about training, we've talked about funding. Do we have places?
We certainly do, yes. So I think there's an important nuance in this discussion. So from a market perspective, there are more than sufficient, we have a surplus every week of residential care beds in the independent sector for us to access. As you'll know, successive government policy over the last 25 years has been to keep people at home wherever possible and keep them out of residential care. The council, as a consumer of the market, we only buy 38% of those beds. The majority of beds in the market are purchased by self-funders. What that means is that in some cases we have very limited opportunity to influence the development of the market. Now, what we do need, and where we do need to work closely with the market, and we do need to work in partnership with them, is there is a lack of beds for people with complex care needs and with dementia in particular. So you'll know that we have the Old Schoolhouse, which is an East Riding Council facility for people with complex needs and dementia, and we set the standard for that level of care with our in-house services. We do need, as I've said, to work with the market to help shape the market and to understand market pressures to make sure that there are sufficient complex care and dementia beds for those people that need them, where they can no longer be supported in their own home. What that also means is that we have to develop specialist services to keep people at home and keep them safe at home from a domiciliary care perspective. And that all comes back to the comment that the chair made about our commissioning intentions and making sure that we understand what our sufficiency needs are.
A recommendation then, if I may, Chair, before my next question, which very much follows on, and that recommendation would be something along the lines of that this council recognises that it can provide care more cheaply per person than the private sector would if we commission services. If the council has to pay for private sector, it costs more than if it does it itself. Well, that's not what I was told on Friday last week.
It depends what sort of care we're looking at. We could
On a like-by-like basis, if I have a set of needs and you have to pay for me in the private sector, it'll cost more than if I have same set of needs and you have to pay for me through council provision.
not necessarily, no. No.
Something that the scrutiny committee will need to look at then, because I
Absolutely.
was told that verbatim by officers on Friday last week at the walkthrough, that the council can provide services at a lower cost than the private sector.
It can provide some services
I
at a
think
lower
we should
cost than the
we should
private
note
sector.
the comment, Councillor Meredith, and
Yes.
ask the CQC committee
Well,
to look at the detail.
The other thing I would like the CQC committee to look at is that I imagine that costs go up exponentially, should, especially as Kim's just said, with dementia, the services become much more difficult, much more onerous to deliver, and that it may even be worth this council looking at focusing, at specialising, at taking the statutory responsibility we have and the lack of desire of the private sector to meet those extra needs, perhaps, and that ultimately there might be some specialisation and division of labour for greater efficiencies, greater economies of scale, greater overall provision, and that's something else I'd like the committee to investigate, please, Chair.
I mean, the committee is obviously going to be looking at the transformation recovery plan, and it's very much focused on a short window between now and end of March. I think what you're talking about is part of a longer term solution, particularly in regards to the commissioning side of the department's work. So I think let's refer that to the CQC committee, but it's going to be a longer term issue to resolve, if that's a fair reflection.
It is, Chair.
Thank you. Do you have a,
And the other,
Councillor Redshaw wants a wiggle, and then we'll come back to you, Councillor Meredith.
Just on the subject of council provided care, we went through an adult social care walkthrough last Thursday, and one of the things that was evident that there's certain homes, residential homes within the council's remit, where the services are not being fully utilised. You know, we've got a lot of empty beds around. Is there anything in place that we're looking at as part of this review to actually bring those the services up to full utilisation?
We've only got one service that isn't fully utilised at the moment, and that's the old schoolhouse in Walkergate. We are looking at plans to bring that service into full utilisation. It is dependent on staffing. It is currently staffed for 25 people, and there is a capacity for 37. Yes, that's right. We need to look at the cost of that and the demand for those services, but also to make sure that we are recovering our full costs through the use of that service as well. So that work is in hand, absolutely.
Okay, thank you.
Councillor Meredith, back to you.
thank you, Chair. It's very much in the same vein. In fact, a lot of these questions were inspired by Councillor Redshaw earlier. The next one is that Paul said at the beginning this has to be front and centre, and I couldn't agree more. But as I've already also mentioned, we have 650 other services at this council, and we can't afford to rob Peter to pay Paul, or in 18 months' time, we'll all be sat here going, why are highways in special measures? Or why is our waste management team in special measures? Because we've taken money from one to put it into another. I realise we have infinite wants and finite resources. And I suppose, the request more than a question is that preventative maintenance becomes a core principle of this authority. If we look at the leisure team, fantastic. Every pound spent saves the NHS 14 quid, which, by the way, Paul, as Chief Exec, now I'd like you to send them a bill. If you would, that'd be great. But in all seriousness, preventative maintenance, even if it's painting a railing so that it doesn't rust and need replacing in 3 years' time, that saves the council 90%. If we can keep people at home, the impact on care provision later, 90% lower costs. And so that's something else that I'd like to stress at this juncture, because we can't sacrifice everything else. But anybody with even an ounce of sentiment and a semblance of common sense has to know that everything in the kitchen sink needs throwing at this. but with a view to the wider picture as well. And how that circle will be squared, I don't know. But this being the overview and management committee, I thought this was the time to raise it ahead of the formation of the CQC scrutiny committee, Chair.
Was there a question in there, Richard?
It started as one, it ended as a point.
Unless there's anything you want to add, I think the point was made.
No, thank you, Chair.
Okay. Sorry. Finally, last but not least, of course, Councillor Whittle.
Thank you, Chairman, and apologies for turning up late. Roadworks and
The traffic
accidents.
around Leven was terrible.
Absolutely appalling. However, I would like to thank both Mr. Bellotti and Kim for making an excellent presentation. My mind is certainly a lot more at ease, and you'll be delighted to hear that the questions which I wanted to ask have already been asked. It's one of the privileges of coming last on the list, I suppose. So feel easy to sum up.
Thank you, Councillor Whittle. We're not looking to actively make recommendations on this report. This is simply, as I said at the beginning, this is a roadmap, and the detail will be examined by the CQC committee. So I just propose that we note and accept the report and thank the director for a presentation today. And we'll look to the CQC committee to track the progress over the next 4 months. Okay. Thank you very much. We have spent a lot more time on this than was scheduled, but I think it was definitely worth it given the importance of the subject. So I'd suggest we just take a 5-minute break now and then we come back for the other item. Thank you. Give it a chance to sit down.
I'll just.
Okay, thank you very much. We'll reconvene. Our second item today is about food procurement, and we haven't had papers in advance, so we're going to have a presentation from Sarah Dyson, who's Head of Strategic Procurement and Stores, assisted by Michelle Braithwaite, who's the Principal Procurement Officer, and Angela Goulton, who's our Senior Catering Manager. So without further ado, over to you, Sarah.
Thank you. And good morning, Chair and members. Thank you for the opportunity to speak to you today about the procurement of food by East Riding of Yorkshire Council. And yes, I am joined today by Michelle, who's Principal Procurement Officer and the Category Manager for the catering category of spend within the Council, which includes food, and also Angela Goulton, who's Senior Catering Manager for Schools and Social Care from the Catering Service team. Next slide, please. So I wanted to start by setting out the current status of contracts. So the Council is responsible for procuring a wide range of goods, services and works to support its operations. In the financial year 24 to 25, the total expenditure with third parties on all goods, services and works procured was 476.5 million. The catering category as a whole, which includes both food and other associated catering equipment and services, constitutes 0.5% of the whole council external spend. That just gives some context of the scale that we're talking about. Procurement of food is undertaken by the council to meet the following needs: the council's own catering operations for resale to the public via our leisure and tourism sites and at council-run care homes and daycare centres, and also for external organisations, which are North Lincolnshire Council, who are named customers on our contracts and make their own purchases, and for schools, predominantly within East Riding and North Lincolnshire, who may use our contracts if they choose to do so. It's important to note that while all schools are eligible to use the contracts and the council encourages them to do so, none are compelled to do so and may choose to source their food from any provider. For example, most of the secondary schools, which have become academised, now use their own catering providers and food contracts, often as part of an academy chain. During the 2024-25 financial year, this council spent around £1 million on food via our contracts. Total direct spend by schools was 2.7 million, and North Lincolnshire Council and other external customers spent around £900,000. The commissioning service for the procurement of food contracts is the catering service team, and we work with officers from that service to support them in meeting their objectives. These have primarily been quality of produce, compliance of produce with legislation, statutory food safety and hygiene standards, distribution network, as we're a large rural area, and cost. There's also a focus on the official government standards for food and catering, which emphasise sustainability and high food standards. These objectives reflect those of the customer base, especially those of the school's catering service for their service level agreements with schools. Procurement of food is undertaken in a way which acknowledges the catering service's need to remain competitive and meet their strategic commercial aims. The service currently has 120 service level agreements with schools and is due to renew these in the next year. They will seek to retain school business by having a commercially competitive offering. And while it's not a condition of the SLA to use the council's food contracts, most schools with an SLA choose to do so. And we know that cost of school meals is a big priority for schools. Next slide, please. So I wanted to talk about where does the food come from currently. So the contracts which the council currently have in place for the supply of food are all awarded to suppliers based in the Yorkshire and Humber region. These are J.W. Young Butchers Limited of Sheffield for a contract for the supply of meat and meat products, and they use several East Riding based meat producers in their supply chain for beef, pork, poultry, gammon and bacon, as well as some others in the wider Yorkshire and Humber region. Our other major contracts are with Turner Price Limited of Wiltshire Road, Hull. These are for a contract for the supply of groceries, ambient and chilled foods, including fresh milk, fresh fruit and vegetables, and fresh bread, and also a contract for the supply of frozen foods. Turner Price Limited also use locally based producers and suppliers in their supply chain when in season, including for cucumbers and tomatoes, carrots, parsnip and swede, raspberries and blackberries, eggs, processed pork products, other chilled meats and sandwich fillings, processed fish products, frozen baked potatoes, and garlic bread. Next slide, please. So why and how do we buy food and other procurements? So I want to talk next about the environment in which we conduct procurement and some of the legislative frameworks in which the council must operate. Firstly, we're spending public money. And so in addition to requirements to meet the highest standards of transparency, to ensure that public expenditure benefits the economy and citizens, and to ensure that value for money is obtained, there are specific legislative requirements under which we must operate compliantly. The founding principles of all the legislation and national guidance are fairness, transparency, proportionality, and non-discrimination. The key piece of legislation which governs our operations is the Procurement Act 2023, which sets out in detail the processes which must be followed when undertaking public procurement and governs the principles under which we operate. The Act ensures that we maintain opportunities for competition which benefit the whole UK economy. It also sets out in detail the requirements for transparency and fair and equal treatment of suppliers. Under the Act, contract opportunities must be advertised in a transparent manner and tenders invited from any suitably qualified supplier, regardless of non-commercial considerations. In addition, Section 17 of the Local Government Act is highly relevant. It specifically prohibits the consideration of, and this is in quotes, non-commercial matters, like supplier location in the award of contracts, meaning that the council cannot reserve contracts for local businesses. This applies to contracts above the UK government set contract value threshold, which in this case applies to all of our food contracts. What this in effect means is that the council must select its suppliers based on objective and measurable criteria, which do not discriminate on the basis of non-commercial attributes. The breadth of legislation and guidance is in turn enshrined in the council's constitution in Part 4, which is the contract procedure rules, and these set out 5 main purposes, which are to ensure compliance with all the relevant legislation, to ensure propriety, fairness, consistency and good practice, to help the council obtain value for money and deliver on the council's corporate priorities, to allow the market the freedom of opportunity to trade with us, and to protect staff and members of the council from undue criticism or allegations of wrongdoing. Procurement at this council is undertaken in a way which meets these requirements, is compliant and legal, and also seeks to support council priorities and the specific service objectives of each commissioning service. In the current and ongoing financially challenging environment, value for money is also a key consideration for this council. Within the legislative constraints, we will always seek to balance all of the needs within each procurement to achieve the best possible outcome for the council. Next slide, please. So what opportunities are there then, given all those constraints, to reflect the importance of the local food producer economy in the council's food contracts? And today I want to look at 3 possible options that we could consider. Social value. So firstly, we can use social value, and we already include social value as a criteria in our food procurement. Social value is intended to leverage additional community benefits from contract activity. Social value delivers benefits to communities beyond the direct delivery of the goods and services in question. Basically, for every £1 spent, we seek to gain additional benefit from our suppliers within the local area. Social value is used in our food contracts to enable us to reflect in our evaluation those local benefits offered by suppliers as part of their bid. And this is where we've seen suppliers promote their use of local food producers and suppliers in their supply chain and offer further additional benefits such as employment and training opportunities. The council could choose to develop a specific set of social value objectives around the local food supply chain. This could be explored by the catering service team in conjunction with colleagues in the council's social value team, and we could then use that criteria as part of our tender evaluation, which would reflect suppliers' ability to offer more to the council in our area. It should be noted that where an increased portion of our evaluation is focused on social value outcomes, other key criteria such as quality and cost will necessarily attract less weight. We could also consider optional alternatives. So in order to deliver choice to the end user of our contracts and enable them to reflect their own organisational priorities, remembering that that includes North Lincolnshire Council and other schools as individual bodies, we can include optional alternatives in our contracts. These could be focused on options to supply locally sourced or distributed food products, in addition and to complement the specified core range of foods which we need to procure. For example, a suitable meat product, a sausage, meeting our requirements would be procured, but suppliers could be invited to offer an alternative, higher welfare or higher meat content or locally sourced meat sausage alongside the specified one. By inviting rather than requiring suppliers to include such options, we remain compliant under the legislation, but can benefit from securing locally sourced food options, which we don't currently have a contractual route to, and encourage suppliers to develop and include these sources. It should be noted that the delivery of optional alternative products wouldn't influence the outcome of the procurement in terms of the supplier chosen, and that the choice of using any such optional alternative products will always sit with the organisation placing the order, for whom cost may be a primary consideration. Another option we could consider is the division of our existing contracts into smaller lots. The council could choose to divide its contracts into smaller lots, which would be formed with the intention of encouraging smaller and more potentially local suppliers to apply for business with the council. Lots could be based on subdivisions of existing food contracts, for example, fresh fruit and vegetables as a standalone contract, or even smaller lots within that, for example, potato supplies or green vegetable supplies. Or it could focus on broader produce requirements, but divided into smaller geographical lots. This approach could encourage smaller local suppliers who only have the capacity to supply a small number of geographically located schools and sites, and who therefore would not currently bid for our large consolidated requirements. Contracts would be of a more attractive scope and could target certain subsectors of the food supply chain. However, we don't currently have the evidence to support the theory that sufficient small locally based suppliers have the capacity to supply in this way. Smaller suppliers also face the challenge of being able to undertake a procurement process itself, regardless of its scope, and meet all of the documentation, accreditation, certification needs to supply multiple sites. Economies of scale currently enjoyed by using a large central distributor, who in turn have their own broad supply chain, would be lost and potentially impact value for money. Schools and other sites would need to accommodate multiple deliveries rather than the streamlined service currently in operation. And this approach would also increase the workload for the procurement services and catering service teams in managing and procuring from the supply base. We would need to prepare the market for this approach, and by working with the economic development team to determine if it would be successful in terms of engagement and to help support and prepare suppliers. My final slide, please. So in summary, whilst the council has awarded contracts for food with an annual value of 4.6 million in total, it only has direct control over 1 million of that spend, which is about 22% of the total. We do know that due to our current contracting, which has secured local and regional key suppliers, supply chains which they use, much of our food is already coming from local sources. While we're constrained by the legislation and the principles for public sector procurement, the council could choose to change the emphasis within our procurement to encourage and reflect positive local food sourcing strategies by our suppliers. The council needs to be cautious in ensuring that any change in emphasis also protects the value for money objective, especially as it may impact on the ability of the school's meal service to maintain and grow its commercial operations. Procurement services are a facilitating professional team within the council, and we will always strive to deliver against all of those varying and sometimes competing council objectives. So thank you, Chair, for the opportunity to make this presentation today. My colleagues and I are happy to answer any questions which may arise. Thank you.
Thank you, Sarah. Very interesting, Erin. And I think there's a number of questions that arise. I'll kick off if I may, and then I'll bring colleagues in. So when you're negotiating price, we're obviously quite a significant buyer in the county, over £4.6 million. But given the bulk of that comes from the schools, are you able to commit to volumes to get the discount, or are you just simply negotiating a set price for an item?
So when we issue our invitations to tender, we set out obviously the whole range of products we need, all our specifications, and we're also including in there indicative volumes, which are based on historical data, and we can be relatively confident would remain the same. But all our tendering documentation does have the caveat that that is not assured, and suppliers make a bid on that basis and they take that risk, but the prices are secured for a set period under the contract. So that's the nature of contracting, really, for the risk balance between us as the buyer and the supplier.
Thank you. And the bulk of the turnover is going into the school lunch department. And you mentioned many of the schools that have academised have chosen to opt out and make their own arrangements. Are they opting out due to they think they can get better value in the open market, or is it quality issues? What's driving their move to not use our contract services?
Just to make you aware, when they academise, potentially they have corporate contracts in place. So they have a contractor and the contractors negotiate their own pricing strategies from whatever supplier they choose to use. So they might have 20 schools in Academy Trust and they'll tell the supplier, we've got 20 schools, give me your best price. And that's why they leave us.
And they think that's potentially cheaper than we can negotiate?
I have no idea. I don't have any data for that, unfortunately.
Right.
We're not privy to it. They don't have to share it with us. But the assumption would be that because they've got their own systems and policies and procedures in place, that they think they can. Whether they do or not, I'm not actually sure. Okay.
Thank you very much. Councillor Walker.
Thank you, Chair. Yes, I was greatly interested in the contractual restrictions in which you find yourself, and certainly not my sphere. So this is a request for information, really. I read a great deal about the Preston model and how that can enrich the local market. Would it be a departure from our contract rules to be able to apply the Preston model of local purchase wherever possible? Or are you already allowed to apply that?
Yeah, I'm sorry, I'm certainly not familiar with the Preston model, so I can't give you an answer in the context of that because I'm not aware of it.
Sorry, the Preston model being specific council policy adopted quite a lot of local authorities who make the decision to purchase locally on purpose, by preference. Clearly, nothing is going to trump values like the quality of the produce, but they understand the value to the community of dealing locally. Invented in Preston, and they collared the name. But I'm not clear if to make a departure in that way, would that require a change of contract rules within this council?
I don't know what value of contract that model is applied. So this council has within its rules requirement on us to seek locally based bids below the legislative value threshold. So contracts in the goods and services sector with a value above around £180,000 are subject to the full UK legislation. That is the point at which we're not allowed to restrict contracting for local sources or other non-commercial attributes. However, below that threshold, we actually do encourage and promote the fact that we would at least seek bids from local suppliers. That's as far as this council has gone down that road. As I said in the presentation, none of our food contracts are of a value that's below that threshold. If we wanted to look at splitting to reduce them to below, we would unfortunately fall foul of another legislative requirement, which is that we don't disaggregate our requirements in order to avoid the rules. So there is that requirement there. And as you know, that legislative requirement does also protect some of our local suppliers, because it means that they can bid for work nationally. Obviously, if every authority tried to restrict, we'd all end up with a very small pool of trade. So there is a pro as well as a con. But in terms of your point, we do it at lower values where we're permitted, but not at this value of contract.
I think Councillor Meredith's got a supplementary on that.
Thank you, Chair, and thank you, Councillor Walker. I'd fancied a wiggle on this one, just purely because how can we let local businesses know that East Riding is supportive of them, that we're championing them? As a local authority, I think we have a responsibility. If Anne Handley was to be sat here with her economic portfolio hat on, if the Mayor's office was to be here with their reinvestment, reinvigoration, regeneration requirements, that there is an element of obligation placed on this authority. And there's lots of food producers in the area, from small, medium to very large enterprises. So how can we not necessarily have a bias in that direction, but how can we recognise the need to support them, recognise the environmental benefits, those third and fourth order consequences, reducing food miles, and not wanting to sound cynical, Chair, but how can we how can we work around the requirements as was very clearly set out in the presentation, rather than taking them on the chin?
Yeah, I think you hit on a very good point there, and it's something which within the public sector procurement community is becoming much more active, if you like, in terms of that market engagement support to get producers to the point where they can engage with the council and win business. So we are about to re-procure next year the food contracts, and we've developed our approach much more in that last 4-year period. So we regularly use what we call pre-market engagement, which is basically publishing and notifying the local supply base as well as the national supply base that we're about to procure something, and then inviting them to engage with us around what their capabilities are, what we might be looking for so they can prepare for it, and just to notify them it's coming and they need to look out for a contract. So we do sometimes work with the economic development team here to have events. That's something we could consider doing for that next round. They also have the supply chain network, which is a website that they use to promote upcoming tender opportunities. We don't usually put contracts of this value onto that, but because we know we're looking at a smaller, it's within the supply chain really that we're looking rather than maybe our primary contractor, but that's something, another tool that we could utilise to get the message out and maybe have engagement sessions where we speak to them. I think it's also important for us to talk to the direct contractors we're likely to use. We have our incumbent Turner Price, to speak to them about how they're going to engage with the supply chain, because that is probably where we're primarily relying on that connection to be made. So we can explore all those issues next year as we've developed our approach.
Thank you, Chair. Could I just make a recommendation then, please, or a couple actually? Things like branding is obviously quite important. You know, if you sell crisps, you put Walkers in front of it, all of a sudden the price doubles. Are we able to do things like at our leisure centres, put things like this meat was sourced locally on the menus, on any notice boards? Are we able to work with schools, for example, and say that as part of a contractual agreement with their food services, that they can have school trips to places like Hutton Cranswick, and actually engage in the sector that way, and make the links tangible, make the links visible? I hesitate to use the word promote. I wouldn't want to be seen as a stooge, but at the same time, it is right. Well, we have obviously got enough faith in them to pay them to provide a good, and they are a local employer, and shouting it from the rooftops.
Yeah, I can't speak to the point of sale notices or within schools, maybe Angela can, but certainly the type of thing around making that connection to our communities, the school children and the source of food production or farms. That's the kind of thing we would look to seek from suppliers in their social value offering. And again, we could direct them more towards, this is the type of outcome we're looking to achieve as a council, what can you offer? And we could definitely look at expanding on that, yeah.
Councillor Walker, did you want to come again? Oh, sorry, you thought you were catching my eye. I noticed in the presentation you mentioned about regional suppliers, but there may be a meat or veg wholesaler or something. Do we know how much of that product is regional produce as opposed to from a local wholesaler?
We started because obviously this has been a live conversation for several months within the council. We have started to explore that data a little bit with our primary supplier, and we're still working on that. It's not something we've captured in the past because it hasn't been the focus of emphasis for our clients, internally the catering team or the council more widely. Clearly it's something we may wish to capture, at least capture that management data as we go forward in the future so that we can answer those questions and see if any change in emphasis in our contracting, even around the social value element, may then drive a change and an increase, so we can map that then going forward.
Thanks. I'm sure that's something that the food workshop team would be interested in. So when you're able to supply that information, I'm sure they'd welcome it. Have you got any further questions? Councillor Smith, sorry.
Thank you, Chair. I'm a little bit confused because obviously we didn't get a paper, so I can go off the presentation. But one of the things I would like to understand is, why do we need to do this as a council? Would it not be better, for example, that Bridlington Spa, as an individual cost centre, went and just sourced their own refreshments from Turner Price? And when I go in the 1 point, for example, and pick up something to eat, it's all tends to be heavily processed, pre-packaged, high sugar food. It's not really what my default choice would be. I'm just wondering if that's something that your department control and put in there.
Yeah, so a couple of points, and I'll address the second one first. So in terms of the specification of the makeup of the food, the nutritional content or the type of food, certainly we fulfil that requirement in the procurement team. It is the catering team who set the requirements, and obviously for schools there are very firm nutritional standards, etc. More widely, I don't know if we're bound by anything particular, but there's a decision that's made on what we specify, and that comes from the catering team as the experts. In terms of different sites making their own deals, certainly as a council, again, if we were to start procuring separately for separate sites, not within one constituted contract, that would be disaggregation. So there is a requirement on us as an organisation, as a legal entity, to scope all the procurement of a certain type of thing that we're going to make within a year, assess the volume of that, assess the total value of that, then the rules kick in. So if the value of that for us was £1 million in a year, so all school procurement, council procurement of food totaled £1 million. So we are required to put that out as one contract in aggregation. So that's why we do it in that way. What we can do within that is to lot it in different ways. So we can have different suppliers for different areas if we choose to do so. The onus has been on aggregating the need, economies of scale, value for money, which is why we've always, to date, procured that from one supplier in aggregate.
Thank you. So essentially what you're saying is, due to bureaucracy, we have to, as a council, put a bid in for 1 million apples and then decide where they want to go. And someone in Bridlington, for example, in the Spa, can't say we want to just go and buy our apples from the grocer in Bridlington, and Beverley Leisure Centre want to go and buy their apples from the grocer in Beverley. We
could structure our contracts to say this site needs a supplier because it's got these distinct needs, and secure them a supplier. That's, again, we haven't done that because that hasn't been seen as cost effective and efficient way to procure to date. The reason really that we have to aggregate all those 1 million apples and procure them as one is because if we disaggregated them, the individual value for certain sites may fall below the threshold. We would procure in a different way, and that would be seen as us trying to avoid the legislative requirement. So ultimately, it's all back to you're spending public money, you have to be seen to be transparent, even-handed, blah, blah, blah. And these secondary rules, if you like, are to avoid you trying to avoid that. Whilst you might be trying to do other things which are valuable and good, it would be seen as trying to avoid being compliant. Okay.
Anybody got any further questions for the team? Councillor Meredith.
The back of Councillor Smith's question, I suppose it poses, how do you balance the equation then of local choice versus legal obligation? So what happens if Bridge Bar want to buy bananas? What happens if they go nuts? instead of getting apples? Like, how do you make it so, for example, a school could say we want to have these options because we consider them healthier, or this is part of our core principle? And really, the question is, how do you balance independence with economies of scale? How do you balance the pragmatism of spending the pound best and bulk buying versus actually saying, you know what, we also need to give people choice?
So any procurement really is, there's three factors. It's a bit of a triangle. You've got cost, quality, and usually time. So there will be a skew sometimes depending on your priorities and your objectives. So in this sense, in a way, the provenance maybe, and the, let's call it food miles, because we can't say geographical location of the source of the food, it falls in the quality basket. So this is why in my suggestions of what we could do, I've talked about the council could choose to change its priorities. So we could choose to put more emphasis on quality, which could include, we want to reduce food miles, because that could be a legitimate and legal way to go. That would mean that we would put greater emphasis on that, which may mean that cost is affected. I mean, I don't have evidence today to say to you, if we go for more locally sourced food, it will be more expensive. I can't say that because we don't have that evidence yet. But I think we all know if we try to go for a locally sourced, high meat quality, you know, artisanal sausage or something, it usually costs more than the bog standard one from Tesco's or wherever. So anecdotal, but that could be the impact. But it doesn't mean we can't do that. It would just mean there'll be consequences, and we have to be ready to accept those. It's where our priorities lie, and we can develop procurement methods within the law that reflect the priorities. And if our priority is changing, we can do that, but there will be a consequence.
I think it's the old adage, Chair, that there's the triangle of time, quality and cost, and you can only ever have two of the three. It's especially true in building works, but in this case, however, I'd also say that if I go and buy the artisanal sausage at Tesco's, it'll be a lot more expensive than the regular banger. But if I was to order 50,000 from a company, and there are those economies of scale, there's more than one way to skin a cat, although please don't put that in my sausage. But being a bit more serious here, that there are ways, and again, it will take time to set up, but you can therefore keep costs down and see quality raised, and there will be ways to do things locally. And so, as far as recommendations from Scrutiny go, if I could suggest that quality, that reduction of travel miles be a factor in decision making, and one that's perhaps given more weight than it is currently, to a point of common sense, not to the point of breaking the bank. I don't think we need to make the stakes go from, you know, sirloin to fillet, for example. I don't think we need to be the cordon bleu of the food world, but seeing standards set, or seeing an ambition to see standards move in the right direction rather than the wrong, because nothing ever stays still, is something that I think we could bring from this discussion as a recommendation, Chair.
Could I just come back briefly to
Yes,
it?
please, yeah.
We just need to remember the amount of that spend that we do have choice over. So when we're talking about economies of scale, it actually, the councils is not that large within this market at all. And we could choose to change the emphasis of the entire procurement. And schools, for instance, might go, we don't prioritise that element of it, its cost. And so we now can't afford to buy your sausages. So we just got to be mindful of the impact on the team and the schools themselves.
Sorry, Chair, and if a pound is spent there, it can't be spent somewhere else, like highways or adult social care. You can only spend those pounds once. I suppose it's really more of an ambition than an instruction or a direction. It's a governing policy in terms of decision making, but it should influence all decisions, but it should not direct them. You know, I think it'd be remiss of us as local councillors to not champion local provision, but at the same time, again, common sense must be applied, and balance, I think, is the key there.
Thank you. I think Councillor
Yeah,
Richard
it was only to support Councillor Meredith in this, in that it would be, maybe the recommendation should be something along the lines of, where possible, more consideration should be given as regards our carbon footprint and managing the carbon footprint. I think that's probably all we're asking for at this stage. Yeah, thank you.
Yes, Adam.
Morning, Chair, morning, members. Just a couple of points to help sort of help the debate. As you know, East Riding, we have 90% of our land is agricultural. So the we are a big producer, and across Yorkshire and Humber, farming output from DEFRA is over 580 million. But when you add the supply chain as well, it's a big sum of money. So what, in terms of the contracts that we're talking about here, it's a relatively small amount in terms of a player. But when we come to the topic of producers, it was interesting because we had the talk about if someone wanted to buy a banana. In terms of where, oh yeah, the banana. So, in terms of what the UK actually produces, and if you think of the stock, only DEFRA's figures, only 16% of the UK's fruit is made in the is grown in the UK. And likewise, UK as a whole, only 58%, according to DEFRA, is UK produces its own sort of food products. I can definitely, you know, I'm supportive of the idea of adding a recommendation about carbon footprint, but I'm just mindful of how, when it comes to Sarah and Michelle trying to draft that into procurement policy, that how do we best do it when we think that all of our rice comes from abroad, 70% of our pasta comes from Italy. I think this committee here, and what we want at East Riding as officers too, is to support our local producers as best we can. And I think engaging with the supply chain, which has been mentioned, and we've also recommended we could look at that with our economic development partners and developing the supply chain for local suppliers and making sure they're part of that. That's definitely something we want to do, and where we can add in carbon footprint, but we'll have to maybe condition it. And I think this links slightly to Councillor Walker's point about the Preston model and social value. So we could build in to our contracts more elements on social value, which includes things like carbon footprint and other elements. But that has to be open to everyone nationally still. That's the procurement law and legislation we're bound in, that we can't discriminate against anyone nationally. So if there was a supplier 300 miles away that could deliver that social value, and well, they could provide evidence, they could adhere to it, then we would still have to, you know, pay attention to them and perhaps award to them. It is a balance in terms of how we deal with sort of the discrimination element of local supply, but we can certainly encourage, and certainly where there is a market in East Riding, try and develop that.
Yeah, thank you. Obviously, there are limitations, as you say, rice, pasta, tea, coffee, not locally produced. So it does restrict the financial clout that you have in terms of sourcing locally. But as far as possible, we think, you know, this, as you say, this is agriculture is the biggest industry in this county, and supporting that where we can is got to be key within the regulations that we have to operate under. So, are there any? Is that a final wiggle, Richard?
Just to say, yeah, that any recommendation here could be it's guidance, it's an ambition, it's not a chain around the ankle or a noose around the neck. It's one of those where, for example, we've talked about, and Leo Hammond will be so glad I've mentioned this, we've talked about climate menus and things, but actually you could say Yorkshire menus. You could turn around and say, actually, we can champion local produce. And let's be honest, if one of your remit is quality, well, we make the best things in the world, fact. And I can point that out by pointing out that I was made in Cambridge because I'm a test tube baby, so I don't apply. But no, again, in all seriousness, it is one of those where there are ways to be clever with this, and again, take pineapple off pizzas because that's for heathens anyways. There are ways and means of doing this with creativity, and I suppose what I wanted to push forward here was encouragement rather than constriction, and gratitude. And thank you, Chair.
Could I just word it in the recommendations like where possible or where practically possible or something along those lines, so not put a ball and chain around their ankle?
Well, quite. There are all sorts of legal restrictions, as we've already heard. So, did you want to put that into words, Richard?
Councillor Smith's actually listened to me and done it for me, so thank you.
Yeah.
I was just going to add, I think a lot of points have been raised by officers in terms of support that can be given to local suppliers beyond for those procurement practices. Maybe if the committee would like to signal their support for officers to do so, particularly in other aspects such as economic development and that sort of thing. And then maybe in some time we could get an update as to some of those actions, but of course, bearing in mind the legislative requirements that we've got to operate under.
Are we happy with that as a?
It's worth noting, Chair, that in about 8-9 months' time, there'll probably be a food review panel coming up. Is that not going to be following the suicide prevention one?
No, so at the last meeting, members resolved not to do that.
That's all. I thought we decided to prioritise youth services over it, not remove it instead.
No, members resolved not to pursue the food strategy review panel and this item was taken.
This is instead, right?
Yeah.
Oh, fair enough. Oh, in that case, then congratulations. Thank you.
Okay, so we'll put that as a recommendation. In that case, thank you very much, everybody, and we'll close the meeting. We've got one other item. Sorry. However, you may leave us if you wish. We've got one other item to discuss.
Thank you, Mr. Chairman. I don't have any amendments to the work programme, but just a couple of points I'd bring up. So, given our first item today and members' experience of full council yesterday, members be fully aware that the CQC Scrutiny Committee has now been established. Myself and my colleagues in Democratic Services has done as much as we can prior to that, before that resolution was made by council. So we're on a good starting block. In the next week or so, I know we've got a number of members here who have been appointed to that committee. Expect to see some movement on that, and that will be pretty quick because we are coming from some preparation, so there will be some dates and such on that. And just finally, I would remind members that it is that time of year now where we're looking for scrutiny items for the next municipal year. So those workshops will be held in January and February. As I understand, and looking at previous suggestions, Overview Management Committee does tend to struggle for suggestions, and I appreciate that the terms of reference of this committee are a bit abstract compared to environment and regeneration or some of the others. But if you could go back to your residents, your colleagues in your groups, and if there is anything that has come up, I would really encourage you to do so.
Councillor Smith.
So on that note, can I ask if this would be the environment to bring up things like councillor training that's offered by officers? And the reason I would like to have a debate on that is because when this training is being put together, it's consistently been put together at times which are detrimental to people like me who are in employment to attend. So we're missing out. And I don't know what the vehicle is to have this conversation. I know I'm not the only member who would like to bring this forward.
There is a separate committee, Members Development Committee, which reviews all requests for member training and considers how long to allocate and the appropriate timing for it. So Councillor Jefferson chairs it. So by all means, feed your concerns into Councillor Jefferson.
But is that a committee that's led by people that are retired, as opposed to people that are in? No, but that's the whole point. That's why I'm asking the question in all seriousness.
Councillor Jefferson chairs it. I'm sure you wouldn't want to suggest that she's not considering all members' welfare. But I mean, there's an issue there, though, of course, in terms of officers work, 8:30 till 5 or whatever their particular hours are. So it's not always easy to schedule training sessions, say in the evening, which might be more convenient for members who work. But yeah, by all means, feed your concerns back to Councillor Jefferson. Councillor Meredith.
Thank you, Chair. And actually, whilst it would inconvenience me greatly to see what Councillor Smith has put forward as somebody with, half a dozen parish councils, playing field associations, other groups, volunteers, my evenings are always a write-off. Anyway, I had 4 evening meetings this week, 4 last, 3 next. Believe it or not, I actually try to have a social life as well. I know I come across as a shrinking lily, but I do try to get out there. But in all seriousness, I think that there is a conversation to be had here, because ultimately we have things things like mandatory planning training for planning committee members. And that's held in the day, which in turn means that there are some councillors who can come once a month to planning, but can't necessarily take an extra 4 days off a year for the mandatory planning training, plus whatever else may be occurring. And it is this committee that does oversee council practices, procedures, policies. So really anything goes. And if Rob can't figure out where it goes, it comes here. It's this environment are the catch-alls, safer and stronger children, young people, health and well-being, very specific remits, but this environment are the safety nets. I don't know what that conversation will look like. I do know that there will be detriments for one and benefits for another. But hey, that's the point of democracy. But yeah, for me, I mean, like in January, we've got all the budget meetings, we've got all the scrutiny meetings, we've got all the scrutiny workshop meetings. You know, I've got 4 clashes already. And that's just meeting 9 to 5, and that's before all the other evening ones. So there's not enough hours in the day, Chair. So if you could have a chat with GMT, I'd be grateful.
Yeah, sorry. Before I forget, Councillor Holtby's got his hand up. Did you want to make a point?
Yes. Now that we're not allowed to ask questions because the time has moved on, hasn't it? But yeah, no, just to say, sorry, I couldn't get there today, but I was, unlike council, I wasn't quite as persistent as he obviously was to get in. I mean, it was the traffic was appalling. So maybe one area we can discuss is traffic management. And I mean, in the particular circumstances where we were being held up today, I did go into Beverley last night, and the lights were still there at Whitecross. Nobody doing any work. Why, why can't they make it so that they work through the night on these projects rather than during the day? Because there are thousands of cars being held up, and I suspect Councillor Whittle won't get back to Hornsey until after tea time today.
It's a fair comment. It took me 80 minutes to get home last night from Beverley to Heading, so I do sympathise. Sorry? No, we don't all want to move back to Beverley, do we? I think this is not probably the right forum, John. So we'll.
Anyway, I just to say on the food procurement thing, I thought it was a really useful discussion. But I think we're not trying to. I don't think that anybody in the agricultural business world and food is asking for favours. I think you'd be surprised how much influence it has if East Riding is seen to be and heard to be being supportive of agriculture in the East Riding. Because I do get feedback with wearing my farming hat saying why is it that East Riding don't promote local produce, and they don't want favours, but they just want to, if we can't have our own stuff in our own area,
I think we maybe can't
at the same cost.
We can't specify that we have to buy locally, but I think there's probably some merit in the suggestion Councillor Meredith made about why not brand it in the leisure centre that it's local produce, so that we can highlight we are supporting local producers, even though we can't specify that in the contracts. Is it possible?
Yeah. Well, thanks very much. Thank you.
Okay.
Well, thank you, Chair. Just to raise the point that we have commissioned a new subcommittee, which will some of that work will overlap with HOSC. So what I would like to ask is if we can make a specific arrangement where the HOSC work programme can be looked at. There may be items we can now take out of there that are automatically the realm of CQC, please.
Yes, so thanks, Councillor Walker, for raising that. So the terms of reference that were agreed at Council yesterday for the CQC Scrutiny Committee, very specific. So anything around the CQC recovery will automatically go to that committee. So there won't be any overlap in terms of items going separate ways. More broadly, in terms of if there was something in adult social care that was completely irrelevant to the CQC committee, that would still fall under HOSC. Not that I'm expecting anything big, but within that as well, and I think it's a discussion for the next Help Scrutiny Committee. There's a space there to make sure we're not overburdening officers during this difficult time. And yeah.
Okay, you happy with that, Councillor Phoenix? Yeah.
That's everything.
Councillor Meredith, final.
Thank you, Chair. Just to channel my inner Rob for a second, and just to say that last Thursday we did all get the pro forma forms sent to us. They are due in on Monday, the 8th of December, so that the topics can be discussed at the workshop setting meetings in January. And just to go back to what Councillor Holtby said about highways, we had a single item agenda meeting for highways of Environment and Regen in June this year. It took 2 hours and 57 minutes. Rob still has a twitch because of it, having managed that meeting. And I have absolutely no doubt highways will be back on the agenda, not least because of the decision at full council yesterday regarding HBAS.
Thank you, Councillor Meredith. So do we just need to approve the
Yeah, there's no changes.
on a
There's no updates to the
Yeah.
product plan.
Okay,